What is gastroesophageal reflux disease? Heartburn, reflux, those are all describing the same set of symptoms that people experience when fluids from the stomach, sometimes even food, washes up into the chest, causing pain. The esophagus, which is the tube that leads from the mouth into the stomach, is supposed to be a one-way street. Food is supposed to go down, and at the bottom of the esophagus, there's a little valve called the lower esophageal sphincter that helps to keep food and liquids in the stomach and not wash back up. If that lower esophageal sphincter is weak, then liquids can wash up into the chest, causing pain, and that's what we call heartburn. Some people feel this more when they're laying down, and it can disturb their sleep. Sometimes the acid can lead to a cough, it can make you hoarse, and sometimes it can lead to permanent damage in the esophagus. Other people have what we call a hiatal hernia, which is where that valve, the lower esophageal sphincter, can slip up into the chest, and that makes reflux a lot worse. Some people also make too much acid. Some people take over-the-counter medications to manage their heartburn symptoms, but you should still mention this to your doctor. Your doctor may recommend further evaluation for prescription medications or possibly surgery that could alleviate your symptoms permanently.
Just in the United States, we have 40 million people suffering from this disease on antacids. And despite that, 40% of them still have issues with the gastroesophageal reflux, with heartburn. If someone has symptoms of acid reflux, then it's important to have it treated. Because the esophagus, the lining of the esophagus, is not made to withstand acid. So if we have recurrent acid going up into the chest, one gets inflammation of the lining of the esophagus, ulcers, the acid can spill into the lungs, give people asthma, coughing, sore throats. So it's important to make sure that we do preventative measures and take the acid away from the esophagus so as to not get complications. Patients that have heartburn can be graded by different tests. One that we always consider is to pass a telescope, flexible instruments, to have a look at the esophagus, see the states of the esophagus, and then proceed to the stomach and detect whether there's any ulcers or the presence of the valve between the esophagus and the stomach. That's called endoscopy. It's an outpatient procedure. Then we have two specialized tests for the esophagus. One is a clever little pill that is a radio transmitter that measures the acid. It gets implanted at the esophagus, and by radio wave it transmits it to a little receptor, a little pager or telephone that the patient wears for 2 days. And that way we can get a tracing of the amount of acid that goes up into the chest. And the last test that we commonly recommend is one called manometry. It's again a high-tech test where we measure the strength, the squeeze of the esophagus, and how well the food will go down the esophagus, and whether the valve at the bottom of the esophagus is working satisfactorily. In the surgical management of acid reflux, we address the valve, the connection between the esophagus and the stomach. Using the patient's own tissue, we fold it in such a way that we create our valve where fluids and foods go down to the stomach, but then they're prevented from returning to the esophagus, therefore curing the acid reflux. This can be done two methods. One, endoscopically, or through the mouth, where we introduce surgical instruments into the stomach and then operate from within, as it were. The more traditional and well-known way is to do it laparoscopically. It still requires general anesthetic, and we introduce the minimally invasive instruments through the abdomen and recreate the valve from outside, but still within the abdomen. Once the surgery is completed, patients stay overnight and home the next day. The advantage of the surgery is that now that the patient has a competent valve, then there's no need to take further antiacid medications, and the condition is resolved, cured.